Hi, Joseph, Dr. Khan.
Call
Wanna
me
thank
Joseph, please. Call me Joseph.
Joseph. We I have a great pleasure to introduce you to the listeners. Actually, you don't need to be introduced, but for the people who don't know you, you are a prosthodontist by training, and you did the program of implant dentistry at Loma Linda. You are currently also a professor at Loma Linda, and you are an adjunct clinical professor at Department of Periodontics and Oral Medicine, University of Michigan. You also are a private practitioner, so you're quite a bit of busy. So, on when it comes to academia, and I've followed your career for a long time, you have written one of the most important peer-reviewed articles. Some of them have changed the concept of treatment that we do in dentistry, such as the phenotype now became very big thing. The defect shape in when we place dental implants and when we graft at the same time. Recipient of many awards of a very biggest dental society specialty academies. And with all of that, I want to thank you for making the time and to come to my podcast. So with that, Joseph, I'm going to start asking you a little bit of question about your the pivot in your career. You know, you started a prosthodontist, and then you moved and influenced the surgical dental implants. So please tell us, when did this shift started and how did it happen? It's a little bit interesting to know.
Well, I mean, it's actually interesting. When I finished my dental school, I was actually wasn't thinking about doing pros nor implant. I was just thinking about doing actually all surgery. And then, this implant thing really stumbled upon me because one of my mentors at that time, as a dental student, I mean, he's a prosthodontist trained in UW, and his name is Kenneth Weichel. And Ken told me very early on in my when shortly after I graduated from my dental school, he told me, "Have I ever thought about implants?" I say, "What is implants?" And at that time, if you remember, right, what 20,
Sure.
30 years ago, implants is like really nothing. And if you look at that time when you talk about perio program or PLOS program, a lot of times the faculties actually do not even push for implants, right? If you do implants, it's almost like you are walking the dark path, right? Something like that. And he told me, have I ever thought about implants? And at that time, he told me that implants could be very interesting. A lot of people doing implants, but not very many people can excel both in the prosthodontics and the periodontic aspect of it. And because as a student, he saw me as I developed, I was able to do both surgical and pros pretty good. So that's how it kind of planted a seed in my mind. And as I'm doing pros too, of course, I realized that implant is changing the whole way we do restorative dentistry. I mean, and that happens to be true. So it just kind of stumbled upon it. And in my career, doing pros is actually hard. I need to work hard on it. The surgical and the periodontal aspect is comes a little bit more natural for me somehow. It just happened by training. I'm pro, so yeah. So all these things somehow stumble upon it, and then very early on, I listened to people like Tanao and some other people like they're very pros trained. So it just got planted in my mind, and that's how I stumbled upon into implant. Yeah.
So I know you love soft tissue grafts. I've seen you lecture about it. And so, in your opinion, when do you think soft tissue round implant should be addressed in augmentation? Is it only for aesthetic, for long term? What's your opinion about that?
Well, I think soft tissue management is very important. And I mean, when we are at our early developmental time, I'm sure you remember in those days, early on, people were just doing implants where it's called bone-driven implant, right? The bone is everything. But then, very early on, I always feel that the soft tissue is everything. And that's when I start playing around with the soft tissue. Now, of course, I want you to make sure we all understand that doesn't mean that when we do soft tissue grafting, 1 + 1 is always equals to 2. You put a piece of, I love to call it a sashimi onto the surgical site. Doesn't mean next thing suddenly you have a piece of sashimi there. A lot of times they don't work to that. Soft tissue has this limitation too. I mean, despite all the people now they talk about can grow papillae and everything, and as a wonderful clinician, and then you work with people like Langer and all those people, I notice, and I'm sure it's not easy to grow a papilla.
Yeah, that's not going to happen in our lifetime.
Once in a while it happened, but that's when people keep showing those cases, right?
But, you're absolutely right. There's one thing that sits on my heart. I love you. I love your how creative, and you have beautiful hands. But one thing I don't know why you like free gingival graft. Tell me a little bit about that. Why do you like free gingival graft?
Why do I like it? I mean, tissue management is like an art, I think. Dentistry. I mean, we can talk all we want about biology, but to be a wonderful restorative dentist or a surgeon, it is an art form, and I love the artistic portion of it, and it translates to I mean very young age I love to use my hand play around, so that just kind of come natural to me for me, and I want to build the tissue to the way I want it to be, not always perfect, but the way I want it to be.
Now let's move a little bit about bone graft. We're going to do that panorama of now the surgical, and then we go into a little bit more philosophical. I see that you like to use xenograft a lot, and especially nowadays that allograft has proven that it's reliable and predictable. What's your opinion on that?
Well, I mean, in my practice, I don't, I mean, over the years, I switch back and forth many times, to be honest. I mean,
Yes.
It's not that I exclusively use one material, and to be honest, right now in my career, very early on, I use mostly autologous bone. Then I start switching to xenograft a lot because one of my mentors, his name is Philip Boyne, and Phil is a big fan of Guy Schlick, and he's one of the person who instrumental in developing the so-called xenograft, the BioOs. So I get influenced a lot by him too, and then later on, I mean more recently, I start switching back to more autologous bone again because I noticed that sometimes on xenograft when we place implant around grafted site with xenograft, if the graft is sometimes not very stable. Okay, and then you implant in, eventually the implant is surrounded by some rocks that's loose, and the biofilm come in and probably high chance of peri-implantitis. That's my observation too. So it's not that I'm exclusive on xenograft. I nowadays I use a lot more autologous bone, and of course allograft into equations too, because I much prefer surrounding the implant with more bone. Yes, than semi-bone type of scenario. So, and doesn't mean that I totally ignore xenograft. I still use it, but I'm mixing a lot more autologous allograft and autologous bone into the equation. Yeah.
That's great. So let's now go to the dental education. You are an academician. How do you assess dental education these days? I know you're involved more in graduate, postgraduate, but nevertheless, we take them when they come from dental schools. So what do you think about it? How do you assess it?
Well, education is changing a lot, especially because of, I believe, social media influence a lot, and also the digital thing, and all those ChatGPT things are changing the way we learn things. Is it bad or good? I don't think I can really judge it because I believe that every generation, I mean, if you look at our fathers, our grandfathers, they always will say, oh, you young kids are not respectful enough. You folks are changing, not as hardworking, but somehow we all survive. So I believe the next generation will survive too. But it's changing because people are relying more on looking. I mean, they're not following the foundation things. They want to jump a little bit higher, faster, because I believe the social media is changing it. Now, like I say, that may not be a bad thing, but it's just teaching students become a little more challenging than before, I believe, because they if they want to know a procedure, they tell me, oh, I went to Google, I went to YouTube, and I'm good. So that makes it a little bit more challenging. But however, I believe that as educators, we must still emphasize on the basic foundations, the biology, rather than all these fancy techniques that people are keep inventing. And you know how it is. I mean, you've been around long enough. I mean, so you don't get fooled so easily on
Yeah.
media. But like I say, like those big soft tissue augmentation, suddenly everything become perfect. I mean, that's not being realistic. So the biology in the end, I believe that we all know that the biology is going to win most of the time. Humbly.
Absolutely, it humbles you all the time.
Yep.
So, the dental students now, or the ones to go to dentistry, they're faced with a big tag, $95,000 tuition. And schools also want to recruit and have full classes. So they are pushing to tell them, as a dental student, you will learn everything, the whole art of that profession, just by doing 4 years of dental school. And a lot of them so what's your thought what's the advice that you give to these young, wonderful people who are going to replace us one day, like going into dental school? Should they take their time in learning, or should they open for everything? What's your opinion on that?
Well, the thing is, I mean, doing dental school is more like spoon feeding, right? I mean, when you get to graduate school, that's when it pushes us to think on our own. So a lot of times the students don't have a choice, right? The school want to expand the classes. They want to push the curriculum into a lot of fancier things. Like eventually, I believe dental students will be able to surgically place dental implants. So one of the reasons is probably because most schools want to, that becomes very attractive. Oh, our school allows students to place implant, right? And things like that. And that's what, but the way I look at it is all the students, because they are, when you go through dental school, it's more like spoon feeding. They don't have much choice, but I believe that they should keep in mind that education is really just beginning when they get their so-called DDS or DMD degree. And if you think about it, just like us too, when we graduate, I mean, do we know everything? No. I mean, I always tell my graduate student, I mean, when I finish even my graduate school, that's when my education in dentistry truly begins, that journey. And I told them that, don't look at me as someone, oh, I'm standing on a podium. It took me easily, my estimation, 10 years after I finished my graduate school training, before I really kind of be able to grasp, my treatment and be able to control things in a very well manner. So the advice for the dental student is, I mean, they need to understand it's a long journey. All right. I mean, we should never let our degree nor our specialty to define us, because that's just a paper, just a title. I mean, education will go all the way to the end. I mean, I remember, one of your dear friend, Burton Lang, right? I remember I had dinner with Burton, some time ago in Australia, and a wonderful dinner. And, he told me that after so many years, that was like maybe 10 years ago, he said, after so many years of doing dentistry and periodontics, sometimes does that mean he know everything? The answer is no. The more we learn, sometimes the more we realize what we don't know. And this journey is going to go all the way till one day our hearts stop beating. So I think the advice to all students is that is a long journey. It's not a sprint. It's not a 100-yard dash. It's a marathon. So they need to be patient, and along the way there'll be failures, and they keep prouding on it. And somehow we will get where we want to go.
So that's the thing that, as you said it, the education, I mean, it's a journey. So I was doing a little bit of research about continuing education, and the whole healthcare in general, it's valued to $90 billion. And they've been asked for every recent graduate to put 5% of their revenue for continuing dental education. Because that's what you said. It's like it's a life journey. So these numbers are enormous. The problem is these young men and women that they're going to go out, they are faced by a lot of programs. Some that they advertise on social media and so on. Although they have AGD, giving, but there's no really a body that govern them or control them or really look into them. So if somebody is looking for courses from somebody like yourself who has been doing this for a long time, what do you think you suggest for them? How can they find courses that they are good and so on and so forth?
Well, this is something that, like I say, that journey is very unique because we all start when we all first begin, we don't know enough, right? We're just exploring. And so it's perfectly okay to attend courses and people will stumble into some really good ones and some not good ones. And also it also depends on the clinicians or the students' personality because some people, they will tend to gravitate to maybe some more aggressive type of courses. Some will, because of their personality, they tend to gravitate into more like conservative type of treatment. So it really depends on the person, and there's no right or wrong to be honest. And then the interesting thing is there's courses catered for all type of personalities, all right?
Yeah.
And so it depends on the person regardless. When we first start, we don't know enough, so we should talk to our mentors, and ask for advices. But the reality is this: you being a teacher and you were a graduate program director, you know how it is. I mean, the students, it's not easy to change the way they think, right? I mean, by the time they come to graduate school, they're already 27, 28 years old. And just imagine how many of those people, how many of the students are when we were 25 years old. I mean, can our parents influence at that age? Probably not. So me as a teacher, I cannot really influence them too. But we are here to provide support. We are here to provide the thinking process. But they also need to understand that that journey along the way, they will stumble a lot, and some of them will find a way. Some will never find a way. So it's hard to know what is the end point. Okay, but I would suggest them talk to experienced clinicians and things like that, and they will be able to give them some advice.
Going to you are a part of the trustees of the American Academy of Osseointegration, which I've been a member of it as well for many, many years. AMO is an organization that specialists gather and they all have one interest is dental implant. Am I describing it correct?
In a sense, yes. There's I mean, more than besides AO, there's some other more like implant organizations out there too, and they try to cater their clinicians into implant. I think what the AO does is they try to, ensure, I mean, cater to both specialists and general dentists, and then they try to encompass both periodontics, oral surgery, pros, and general dentistry into this implant thing. So in a sense, I think the idea is good. I believe the idea is good.
And so if a recent graduate wants to be involved in implant dentistry, so do you think do you advise them to start immediately after they finish dental school or to take some time? What is your think about that? You're somebody who has two hats.
Yeah, I mean, if they're interested in implant, definitely join some of the implant organizations, take some of the courses. I would not, I would, and again, everybody is different, but I would suggest them to do it right away. I mean, why wait, right? There's no point waiting. Nowadays, implant is such a big part of, dental treatment. We almost cannot ignore it anymore. So yeah, I would suggest young students to jump right into it.
Okay. Alrighty, so now we will get to the best part, which is the end one, and getting to know Joseph the man. We know about you as a great clinician, great lecturer, and thinker and writer. So, what are your hobbies?
My hobbies, okay, I love photography. Okay, I mean, ever since when I was a young kid, I I remember my mom got me a really, those days a very rudimentary SLR camera, and I love taking photos, I mean, and I was taking photos for, I mean, for nature, sometimes even for people's events. I even so a lot of even sports events. So that was one part of my passion. And but the good thing about that is I don't know that when I do dentistry, taking pictures is a big part of the game if you want to do some documentation or speaking. So that kind of stumbled into my path, and because of my passion in taking pictures, it also trained my eyes too, and so both in restorative dentistry as well as periodontics. I mean, the eyes, what you see is so important because I always tell my students, you cannot treat what you cannot see, right? So that is a big part of my passion in terms of photography is a huge in my life. And if you talk to my graduate student, they'll sign that in my office I have around 6 cameras. They think I'm crazy, and I'm crazy.
Creativity needs some craziness, no?
Yeah, that's true.
Songs. What are your favorite songs?
Oh, you know what? The funny thing is, I'm a bad singer. Okay, people take me to karaoke. I mean, they just say, "Oh, bad." They want to shut my mic off. But I just like to listen to easy music. I mean, of course, I mean the general pop music and things like that. But I tell you, one of my favorite music that I really enjoy, and is a new age. This person or group is a new age. There's a new age music, right? And then my favorite artist in the new age that a lot of times when I'm stressed out, I want to listen to. I don't know, have you heard of this? It's called Kitaro, Kitor, Kitaro. Okay, so and it's a new age music, and the pieces are pretty soothing, very zen like. So every time I remember, you remember a few years back, I need to do a live surgery for the AAP. All right, that was in
Yeah.
Vancouver. And beforehand, I remember I just sat there, just listened to that music, just like make me into that stand mode. So I kind of like those new age kind of music a lot. Yeah, soothing my soul.
Oh, but you are a very calm person. I always admire you on that. Uh, Sports. What is it that you like? You are a
Well,
soccer.
okay, now I don't go so crazy on sports. Before I was like a crazy basketball fan. I'm still a crazy basketball fan. I play a lot of basketball. So I used to get my fingers busted because of how it is.
Oh yeah.
And then I always think I'm Michael Jordan,. But I'm not Michael Jordan. And I always want to dunk the ball, but I'm only 5'11", so I cannot really dunk the ball. So but that was my yeah, I love basketball. So but I'm not particularly gifted in it, but I love to play basketball.
Uh, Anything else that you like to tell us about you as a person?
No, I think for me in general, I mean, I'm sure the audience, there'll be a lot of students in the audience, and a lot of people say, "Hey, how do you get to where you are?" or whatever. I mean, success is not something that you can predict. And I mean, I think as a clinician, I mean, all the young clinicians out there, I mean, they look at people like yourself or all the big name people like Langer, they're on the podium and they admire you guys, right? So, but the reality is, like fame is not something that we ask for and it will come to us. it takes a lot of hard work, a lot of persistency, okay, resiliency. And that means I'm sure you know we fell down a lot and we climbed back up and we just keep fighting. And fame and fortune is just a happens to be a byproduct, you know, and sometimes it happens, sometimes it doesn't happen. So like even so, you know, you talk about sometimes my publications or research. I mean, I do research not because I want to be known or not because I want a famous publication, you know. I mean, I do research just because I'm curious, I think. And I never consider I never ask for favorable results. I mean, sometimes my results are not favorable too, but it is what it is. And as you know, I mean, even we talk about sometimes immediacy. I mean, back in the days, I mean, when I first published an article immediacy, I actually get frowned on a lot. I mean, people kind of say, "What the heck are you doing? You are just out of control, right?" I mean, now immediacy is such a big term. You know, I mean, if you look at it 20 years ago, boy, right? I mean, even a lot of the companies now embrace immediacy before you can do it. It's almost like you're committing a crime, right? So I think that you know the advice is always you know don't follow everybody's path. You got to make your own path. And a lot of times we get to where we are because not because we just follow people. You know, you want to create your own path there, and that path may not be lead you to fame, but you know it's good enough. It's that journey that's so special. That's how I feel. That's my advice to all the young clinicians out there.
It is exactly. Is there anything you would change in your life if you have to do?
Well, you know, I asked myself, would I do exactly what I do? Would I do dentistry and things like that? I mean, I have my moments too. Sometimes dentistry is not easy. If you want to be a decent dentist, it's a lot of hard work. But you know, there are many times I say, "Oh, you have a chance, I would have done something else, like medicine or something else." But you know, in the end of the time, I still feel, you know, we are really walking on an amazing path. I mean, what we do, just imagine what you and me are doing is exciting, it's groundbreaking, and you know, and people pay us for it. I mean, what else more can we ask for? So yeah, I would say that I love what I do, and I'm sure you love what we do, and very important for the young audience is whatever path you choose, you must, you know, choose something that you're passionate about. Because if you love what you do, suddenly nothing is hard. I mean, you know, you're willing to work until midnight for it and fight for it. You know what I mean?
Uh, well, I want to really thank you, Joseph. You've always been kind to me, and just let everybody know that during COVID, you've generously offered your time, and you did Zoom with our resident at that time, and you've always been kind. You always everybody loves you, and I am a big fan of yours too. So thank you so much for making the time, Joseph. I really appreciate it, and wish you always all the best, and keep going, and give us some new stuff to get better.
Well, we keep pushing each other. That's how we work to become better and better. So, I mean, we are grateful to have people like you as leaders around, you know, both in perio and in the dental world too. So, and that's what we need, more and more people like you and others as we keep pushing each other and hopefully make the world better. That's the key right there. And I appreciate you having me in this session here.
Thank you. And to meet again in person this time, I wish you all the best and have a wonderful evening.
Look forward to
Thank
see you
you.
soon. No, thank you. Thank you very much. Thank you.